to Safe Inside, brought to you by TheraTribe. I'm Jeremy Loomis, and these are my conversations with Sandra Fields, an LPC and certified clinical trauma treatment provider with over 35 years' experience helping people who have been through trauma. Welcome back to Safe Inside, the podcast brought to you by TheraTribe. I'm Jeremy.
And I'm Sandy.
And we are beginning our conversation about ACEs, Adverse Childhood Experiences. This topic will be at least a two-parter, and we may have more to share in the future, but today's the first episode of our ACEs discussion.
I'm excited about it, actually. I think we promised to do this a while back in one of our other episodes. So I'm excited to get started on this because ACEs are such an integral part of trauma work. Knowing about these ACEs and being able to counteract them is part of what we do. So I'm using this acronym ACEs, and I use it all the time, and then I have to remember that not everybody knows what that stands for. And it literally stands for Adverse Childhood Experiences. And so there was a study done back in the early 90s, and it was one of the largest studies ever done in the United States. And it was actually done by a doctor working with patients who were obese. His name was Dr. Vincent Felitti, and he was he's an endocrinologist. And he ran a successful weight loss clinic at Kaiser Permanente in San Diego, California. Many of his successful patients dropped out of the study or gained their weight back, and he couldn't figure out what in the world was going on. Why couldn't they keep their weight off? So he interviewed them, and as he interviewed them and tried to figure out what was happening with them, he found that a high percentage of these patients, they had abuse in their background, they had household dysfunction, or they had neglect, all during childhood. So in 1991, he presented these findings to the CDC. And Robert Anda is another doctor who was very interested. And so together, these two men set up the largest study ever to examine the link between adverse childhood experiences and health over the course of an entire lifetime. So it was an immense study that they set up. And so this was actually a collaboration between these doctors, the CDC, and Kaiser Permanente. So it was a retrospective and a prospective study. That means that it went back in time. So they would ask patients about things that happened in their childhood. So that was the retrospective. And they actually looked at 17,421 patients, which is an amazing amount of people for a study. And so they these people would come in and present for their annual health exam, and they agreed to fill out a really long questionnaire about their childhood. And when I say childhood, I mean from birth to the age of 18. The average age in this study was 57. The demographics, 80% of these people were white, 10% were African American, 10% Asian, 51% female, 49% male, 74% had some college, and 46% graduated college. So the first thing that we know about this particular study is that the participants in the study were mostly white, well-educated, and middle to upper middle class was what the demographics showed of this particular study. The ACE questionnaire that they asked them, there were 10 questions that they really wanted to know the answer to. And it was the 10 questions looked at emotional abuse in childhood, physical abuse, sexual abuse, emotional neglect, physical neglect, loss of a parent, domestic violence, family member with addiction, a family member with mental illness, and a family member that was incarcerated. So I'm going to give you just a second, Jeremy, and see if maybe you have a question or a thought or anything to interject.
Sure. Yeah, these categories, I think a lot of them are pretty straightforward. What do you think about the area of neglect? Somebody listening today who might say, "Ooh, I probably better pay attention to this because I know at least a couple of those happened to me in childhood. There is almost like a compounding effect in ACEs when you've had several of them. The health outcomes are predictably kind of a lot worse. So it seemed like to me that neglect is the only one that might be a little more ambiguous. Like conceivably, you could have been through neglect and not necessarily recognized it as neglect. Have you come across that with a lot of the clients you've worked with?
I have actually. I think sometimes that neglect is the effects of neglect is very much underrated. And I have a lot of clients that show up and they're showing some of the health issues that ACEs lead to. And they might also be showing, of course, a lot of the emotional responses that we have when we've been traumatized as children, and which have impacted their neurobiology, which I think we've talked about somewhat in prior episodes. But when they show up with these things, part of what I look for is that neglect. Because when I ask them, have you experienced any abuse? The answer is no, no. But then come to find out, they might have had a parent that didn't actually pay any attention to them. And I don't mean like they didn't play ball with them and things like that. I mean, literally, it was as if the child wasn't there. Or I would find that they didn't always have someone to get them up in the morning and feed them breakfast and get them to school. People would neglect that. There's medical neglect. There's those kinds of things too. They may not have been cared for. They may have been invalidated. And yet this still, like you said, it has the same effect in a lot of ways on the neurobiology as does actual physical abuse. So neglect is one that usually when people show up for counseling, they're not necessarily aware that what they need is some trauma work. They're looking for resolution for their problems, but their resolution is to do some trauma work, actually.
Yeah, some of those things can stay invisible for a long time. I mean, sometimes you could be through trauma, but not want to come to terms with the fact that it is trauma. And you may not want to come to terms with the fact that it was neglect either. Like there's a lot that you hear about people missing the warning signs when their own kid is dealing with something very difficult, because you don't want to believe that that would happen to your kid. And it's really tough that it works that way. But, you know, between that and this common experience of distancing yourself from your own emotions, it's kind of a haze for a lot of people to walk through, I think. The only other thing that I would add before we get into it is, for those listening, recognize, as Sandy said just a few minutes ago, what the survey sample came from. Recognize this as a starting point for understanding this. This is a model for understanding the likely outcomes of having been through certain experiences, but also recognize the limitations of the for instance, socioeconomic groups that were mainly drawn from to get the participant, to build those statistics. If most of them were doing kind of okay economically, that's going to paint a slightly different picture than you would get if, for instance, let's say that your family was never above the poverty line. That generally comes with its own stressors that might make everyday life look harder and might have people on an even shorter fuse. There's unfortunately just a lot that tends to come with poverty, and that just may skew the statistics. So this isn't meant to be we're not painting a universal picture, but this is a great starting point for understanding cause and effect with some of these experiences.
You bring up a really good point, Jeremy, because they have done the study with other groups at this point. I mean, they have taken it further. And because of that, there has been an expanded version of the ACE questionnaire that includes several other questions that might impact people of different cultures, different racial backgrounds, different socioeconomic. Usually the Philadelphia expanded ACE questions is used There's a lot of other ones too, but the Philadelphia seems to be the most popular. And those extra 5 questions that the Philadelphia expanded ACE questions look at witness violence, felt discrimination, adverse neighborhood experience, if they were bullied, and or if they lived in foster care. So they've added those 5 questions to the original 10 at this point in a lot of places, which I think is definitely necessary because those have the same effect as the other 10 questions on our health as we go throughout our life. So if you feel triggered or you start feeling, as you're listening to this, feeling overwhelmed yourself, or you're thinking, well, goodness, I have all 10 or 15 of these ACEs or whatever, I want to remind you, this is not a forever sentence. Trauma is not a lifelong sentence. There's things that we can do to help increase your resiliency and help you move past this and into that post-traumatic growth. And so as I talk about it, I may remind you all as we go along that don't see just the bleak side, but because it can feel overwhelming. Anyway, back to the findings. We do know that ACEs, or adverse childhood experiences, are very common. Over 50% of people in the United States experience at least one ACE in their childhood. ACEs are actually uncommonly recognized. Most people don't pay as much attention to them as they ought to. And these adverse childhood experiences, one of the things that we know is that people carry these and we all conceal them. They're concealed by time, they're concealed by shame, by secrecy, and by social taboos. We just don't talk about these in our society. ACEs are the strongest predictor of adult disease risk factors, disease and early mortality. Hear that again. Adverse childhood experiences are the strongest predictor of adult disease and lower early mortality. I never can say that word, mortality. Public health problems are actually solutions or coping strategies for people with unrecognized early adversity that no one talks about. So all of this trauma is overwhelming our public health systems because the cause is actually the childhood adverse experiences. So the findings were a bit overwhelming. There were different categories of the original 10 questions. The first category was abuse, and there were 3 questions around abuse, and they were sexual, physical, and emotional. At the time, they only split the genders into 2 genders for this particular study. We are well aware that there are other genders, but for this particular study, they listed them as male and female. Sexual abuse, when they did the original study, and remember, this is the mostly white, middle to upper middle class, college educated group. Of the women, 24.7% reported that they had been sexually abused as children. Of the men, 16% stated that they had been sexually abused as a child. Physical abuse by a parent, 27% of the women reported this. 29.9%, almost 30% of the men reported this. Emotional abuse by a parent, 13.1% of the women and 7.6% of the men. So I'm going to take just a minute and ask Jeremy, since you're listening to the statistics, what your reaction might be to hearing that about the abuse category.
Yeah. The first thing that comes to mind, really sharing for the sake of the audience, is statistics don't always feel all that real. It's not the same as hearing somebody's story. But anytime you hear a statistic, and for instance, it's 16%, okay, 24%, that doesn't sound like so much until you think about, okay, anything that's more than 10% means that any time you're in a room with at least 10 people, the likelihood is at least one person is a statistic. So that's most of the time that you get together for a family function or meet whatever kind of community you're in. This means that this happens all the time. that's a rather sobering thing.
And to take that
it gets
further,
pretty real pretty fast.
it does. Just those statistics, like you said, if we were in a room of 10 women, just 10 women, 2.5, so 2 to 3 of those women would have been sexually abused as children. If we were in a room of 10 men, 3 of those men would have been physically abused as children. So it is very impactful. If you're in a room of 100, of course, you're looking at more. So it's quite a few people who have experienced this, and the percentages are much higher than we in our society like to think about. We talked in one of our episodes about the myth of childhood and how we sort of romanticize childhood and the protection and innocence of children. And yet these statistics say that our actions are not aligning with what we say are our societal values. For neglect, the next category was neglect. And there were 2 questions in there, and that was around emotional neglect and physical neglect. Of the emotional neglect, 16.7% of the females said that they had experienced that, and 12.4% of the males. For physical neglect, 9.2% of the females and 10.7% of the males stated that they had experienced that. And as we were talking about the neglect a minute ago, Jeremy, there's quite a few people, around 10% of our population, that have experienced neglect to the level that it was actually abuse. And so it had that traumatic impact on these children who are now adults.
You got to wonder sometimes, not to project too much over the results they got, but you have to wonder sometimes too, would a person's answer to a basic question like that be different if they were given a context to know what that might look like? On the one hand, I can appreciate not wanting to ask leading questions if you're conducting research, but at the same time, some of these things, as we've already discussed, they can be kind of buried, and they could be suppressed to the point of, they may not have memories to equate their experience with something you'd call neglect, for instance. And because of that, people conceivably could be answering as honestly as they know how, and we may still not be getting the full picture.
We actually don't think that we're getting the full picture. We think that all of this is unreported, even in these studies. So yes, you are right there. The questions, there are actual questions. I'm just going through the categories, but there are actual questions that kind of give them an idea of what they're looking for. So it does have a little bit of context, but like you said, it's a study, so they don't want to lead in any direction. So it's there. But I agree with you 100%. And neglect is one of those ones that's even harder to pick up, because people may not see that passive neglect as an active.
Yeah. It can be, well, really, for the sake of anyone listening, it can be almost the sort of thing that you have to backtrack to say, okay, I see these things in my life right now. Where did these things come from? And sometimes you have to look at the consequences and see, almost like a forensics expert, right? You like study the scene and see, okay, what happened here? Yeah. And if the shoe fits, it maybe neglect ends up explaining some of it. It doesn't have to mean, some of you might say, my dad loved me. He flew off the handle sometimes, but I know he loved me. Having somebody who was unstable as a caregiver, who wasn't consistent in the way that they treated you, being neglected doesn't have to mean you had a parent who didn't love you. It may just mean that they didn't have it in them to be consistent towards you.
Right. Or they may have had their own trauma coming forward, right? It's one of the many ways that generational trauma is sort of passed down. It's interesting to find, at this point, I want to take a moment to remind you of your resiliency. And sometimes some of my clients come to see that their growth and their post-traumatic growth and their learning to use their resiliency has become what they consider a superpower. And to give you a good example of someone that you can actually look at, On YouTube, there is a guy who did a whole series of videos. He had a dad who was not involved and he felt very neglected. He didn't teach him how to do anything in life. So this man, when he got older, took that and turned it into something positive. And so the name of his YouTube channel is Dad, How Do I? And then in these things, he shows you all of these things in each of the videos of things that dads would teach you normally how to do in life. And it's such a helpful thing, but it's also a very positive way that he took this childhood adversity and turned it around for something good. I never ever say that our trauma makes us stronger and our trauma, whatever, our trauma hurt us is what it did. However, we through that can grow and become stronger because we can develop that resiliency within us and learn to turn it back on itself and use it for good. So it can become our superpower. So we have great superhero origin stories if we've been through trauma. So there is that.
Right. Yeah. Yeah. That's a thing that I think this could help put it in perspective a little bit. It's like, if you've ever known a time of complacency in your life where, you're just like, well, I could do this, but I could go to the gym. I don't really feel like going to the gym. Sometimes the hard situations, we wouldn't say, oh, I'm glad this happened to me. But sometimes that stirs you up to say, either I'm going to grow from where I am, I'm going to do something to build myself up, or I'm sunk. So it can be a terrible circumstance can be a motivating factor to build yourself up.
Absolutely can. And the things that we learned through our trying to survive through that can also become our superpowers. And, if we can turn it around and make it a superpower, good for us.
Yeah.
Back to the findings. I don't want to lose track. There was a third category. So if you remember, there was abuse, neglect, and then the third category was household dysfunction. And there were there's 5 areas that they look around in that one. Substance abuse in the household, was someone using illegal substances or overusing alcohol? Was there mental illness? Was one of the adults in the household mentally ill? Was the mother, the original question said mother, was the mother treated violently? That wording has now been changed to keep up with our society. So was an adult in your family abused physically? And was there parental loss? And that parental loss could be through death or divorce or abandonment. And was an adult, a family member in your household, imprisoned? So those were the categories and the different of the 10 questions. We looked at the 3 categories. We have abuse, we have neglect, and we have household dysfunction. Remember that at least 50% of the United States, people in the United States, have experienced at least one ACE. I'm wondering about the impact that has on all of our systems, on all the way that we think, all the way that we function as a society. And if when we started adding in, like Jeremy, you pointed out, the different socioeconomic groups, different marginalized groups, and we started adding that in, the ACE number would increase tremendously. There was a while I was working at a large company, and in that company, it had both a foster care organization and a mental health organization. And I was a chief quality officer, and part of my job was to create and implement a trauma competent organizational model throughout. So I would go around to all of the facilities and train the staff. And part of what I would train them on is this information. And then I would have them take their ACE questionnaire, just the original 10. I have them take that. And then we would have them do a poll everywhere. And the poll everywhere, a lot of you may not know, but it's an interactive thing that they can just put it in their phone and they can answer through that. And it goes to this program in the cloud. And then I could project their responses in live time on the screen as we did that. The responses, by the way, I want to say, were anonymous. We had turned off that to keep it anonymous. One of the things that we do know is that people that work in our field, in the mental health field, we tend to have much higher ACEs than the normal population, which is turning it into a superpower, I would suppose. However, it was extremely shocking the number of times that we would go to organizations. The average ACE score was about 7. Many times, the average in these places, many times we had a lot of people who had 9 and 10 ACEs, which is a lot of ACEs. And so I learned really fast to make sure that I continue to talk about that resiliency, because even mental health professionals, when they looked at their scores and they heard the data and they heard the health data, it feels a little overwhelming. So I'm going to remind you yet again, we're going to talk about ways to mitigate the effects of this, of the childhood experiences. There are things that we can do. We can actually make physical changes in our body. And I do want to talk about that in a further episode, but we can actually change some of our body through trauma treatment. That is actually the answer is trauma treatment. But we'll talk about those in further episodes. So I know, Jeremy,
and that's coming soon. The only thing I'll say before we continue is just again to put it in perspective, just the impact of this. If 7 was the average, y'all remember from school how you make averages. If 7's the average, that means no matter how many you have that were lower than 7, you had a lot above 7 to make 7 the average.
Yeah, it was crazy. There was always a few that there were 0 ACEs, but it was very, very few. It'd be like one answer. But I want to say that, the study was a little bit skewed as I did it because we were healthcare professionals. But as part of the population that we were looking at as we did this at each facility, it included the admin staff, it included the accountants, it included the case managers, it included the therapists, it included the foster care workers, it included the CEOs, it included, all of the staff. So if you think about a wide range, they weren't all therapists or case managers. There were also like I said, the management team and the admin staff. But we polled everyone all the way up through all the CEOs at all of the companies within this parent company when we did this. The data was pretty surprising until we looked at it and then thought about it. And then we were like, okay, maybe it wasn't as surprising as it felt. But it seemed shocking every time we did it because those numbers would go up on the screen and you could hear audible gasps in the in the audience or in the participants that were watching.
Well, isn't that weird? It's funny because there's things that are obvious, but not until you put the pieces together. It's like in hindsight, it's obvious, but it's like, look, the thing isn't real until you look at it and point at it.
Yeah. And that's kind of what this was like. So I think, Jeremy, this is a good time for us to kind of wind this episode up because, the next piece that we're going to go into is probably going to be a little bit longer too. So
sure.
Yeah. Do you have anything that you want to add to this?
Yeah. So Sandy, you mentioned that these ACEs have resulted in kind of overwhelming the health system. I would say just to our audience, we're going to talk more about this subject, but just try to keep an open mind right now. If these things are a bit hard to swallow, it hasn't really been standard in our social paradigm to look at, for instance, stress causing disease. We haven't necessarily equated, emotional hardships or lack of a stable connection with your caregiver is resulting in disease later on in life. If you've ever had to have a surgery or been diagnosed with a heart condition, you may have just kind of looked at that as a thing that happened that now you have to deal with. So the cause and effect of it all, we're seeing more in these past 30 years than we saw before about how integrated holistically we are and how these things can be what fracture us. So keep an open mind if this is a bit out of the box for the way that you frame things up naturally in your mind. And yeah, again, just see if the shoe fits. So that's it for part one of our discussion on ACEs. Join us next time, and we'll at least give the balance of the introduction on these things, with maybe more to discuss on this topic in the future.
Sounds good.
Talk to you soon, guys.